Good morning and welcome to another Ministry of Health virtual media conference on the national COVID-19 response. Today we have with us the Honorable Terence Dialsing, Minister of Health, Dr. Avery Hines, Technical Director, Epidemiology Division, and Ms. Patty Ann Williams. I am Al Alexander, Senior Corporate Communications Officer at the Ministry of Health, and I will be the moderator for this morning's media conference. We invite Dr. Hines to begin with the clinical and epidemiological updates. Morning.
Thank you, Mr. Alexander. Good morning, Honorable Minister. Good morning to my colleague, Ms. Williams. Good morning to members of the media, members of the viewing and listening public. As we move to the first slide in the presentation, we are looking at the data as at November 23rd at 4 p.m. and at that date and time, we had completed 193,000 total tests at both public and private facilities. Of those, we have 66,975 total positives, and those total positives are broken down as follows. We've already had 56,030 total recovered patients. We have 8,947 total active positive cases, and we have had 1,998 COVID fatalities, and we extend our condolences to members of those bereaved families. The active positive cases are further broken down into 7,607 individuals who are in home self-isolation, 529 individuals who are currently at the hospital, 129 individuals who are in step-down facilities, and 682 new positive cases reported in tests run over the last 24 hours. Now, the vaccination figures as at 4 p.m. yesterday were as follows. Total individuals vaccinated with their first dose of a two-dose regimen stands at 639,053. Those who have completed vaccination fall into a number of categories. There are those who have completed the second dose of a two-dose regimen. Those number 595,655. Those individuals vaccinated under a single-dose regimen currently number 41,230. So that the total persons with a completed vaccination regimen currently number 636,885. In addition to that, those individuals who are eligible for and who have already received an additional primary dose are now 13,523 persons. And just as an ongoing reminder, as the parallel healthcare system continues to grapple with the increasing numbers, we still note that the vast majority, in this case 91.7% of those individuals in care between July 22nd and November 3rd have in fact not been fully vaccinated. We're going to move directly into the epidemiologic update. So moving to the next slide, looking at the epidemic curve, we see that those dark green bars at the right-hand end of your graph, those bars represent the number of daily cases for November, and those are now beginning to rival the numbers or the heights of the bars in May. So we are seeing an upswing again in the month of November, and you also look at the dotted line running through that graph, which represents the rolling average, and we see that steep climb, again indicating that there has been a surge in the number of cases in recent times. Moving to the next slide, looking at the same data now aggregated at a weekly level, on a weekly basis, we see that we've been seeing increases in the weekly totals from about week 39 to 40 going forward. So from week 40, we've seen increases of between 10 and 59% in the week-on-week totals, and we see that represented by the increasing heights of the bars between October and November, October being the bright green over the right-hand side and November being the slightly darker green at the very end. Behind that, the backdrop, that peach color we see, is the total positivity, which is the percentage of cases that have been tested for COVID and come back as positive. And we see that that too has climbed to figures that are much higher than the previous 3 or 4 months. We are now seeing figures in the 40s and 50s in terms of percentage of cases tested and coming back positive for COVID-19. So that positivity has increased, and it reflects a higher level of viral circulation within the population. Moving to the next slide, we see that if you look at that same data now at a monthly level, on a monthly basis, already, although the month of November has not yet finished, we are seeing that the total for November has surpassed the totals for July through October, and in fact June. And the positivity in the background of that has crossed or just about reached the 45% mark. So we're seeing those increases aggregated and reflecting a definite change in the viral circulation pattern at this point compared to the months of July, August, and September. Moving to the next slide, we do see that the demographics largely remain the same in terms of the age groups most affected, the age groups most reflected in the positives. So those age groups still are just about 51% of the 25 to 49-year age group, 59% of those who are positive in the 25 to 49-year age group, and the male-female balance remaining approximately 50-50. In this case, 48.8% male and 51.2% female. Moving to the next slide, what we notice is that where the deaths are concerned, we do still have that preponderance of the fatalities occurring in the over 60 age group, but of note, there are a significant number of individuals under 60 who have also passed on, and the risk factors for those adverse outcomes include the presence of comorbidities, meaning pre-existing conditions, and at this point also the absence of vaccination. So just to remind individuals with comorbidities and without, that vaccination reduces the risk of having severe illness, hospitalization, and death. Moving to the geographic distribution, so next two slides, not this one, next, thank you. If we look at the communities and we look at the basically the hue of coloration in those communities, we're seeing that there's several communities with the darkest of the colors, now over 50 cases in various communities, both across the east-west corridor, across into the east, central, and south Trinidad. So we're seeing overall that where there are concentrations of individuals, those communities also have increasing numbers of cases on a week-to-week basis. And if we compare that now, looking at the week-on-week changes by county in the next slide, we see that for the weeks, epi weeks 44 and 45, for all of the counties basically, with possibly the exception of Nueva Mayaro, we did see an increase in the numbers of cases in each county from week 44 to week 45, the purple being week 44 and the gold being week 45. And that really represents the increase that we are concerned about with respect to the countrywide surge in the numbers of cases of COVID-19. If we move to the next slide, we see that now represented over a longer time frame. So the counties are labeled at the bottom, and each county has seen significant increases in the number of cases per week over the last 3 to 4 weeks consistently. So we are again pointing out to the population that we are seeing countrywide increases in transmission of COVID-19. The mechanisms for preventing or reducing your risk of transmission remain the same. Those are adherence to the public health guidelines, washing of hands, wearing of masks, adhering to the recommendations not to move around when you are either ill or have been in contact with an ill individual, and vaccination, which reduces your risk of serious illness and fatality. So with that, I'm going to turn you back over to Mr. Alexander.
Thank you, Dr. Hines. We go to a presentation from Ms. Patty Ann Williams, Chief Technical Coordinator, Disaster Preparedness, and she will speak on the role and function of the Ministry of Health's Emergency Operations Center. Patty Ann, morning.
Good morning. Thank you, Al, to the Honorable Terence Dialsing, Minister of Health, Dr. Avery Hines, Technical Director, Epidemiology, members of the media, viewing and listening public. I will move forward with my presentation to create context. The Health Emergency Operations Center is a centralized location which facilitates the coordination of health-related responses to emergencies and disasters. It operates in both crisis and non-crisis situations. It's responsible for monitoring and identifying events that may require organization-wide response. When is the HEOC activated? Our HEOC is activated when response capacity is exceeded or expected to be exceeded. Centralized coordination and control is needed. External response mobilization is required, and international assistance is likely to occur. The core functions of our HEOC include monitoring of our events and incidents, collecting and analyzing of data, managing of key contacts and focal points, briefing our relevant task forces, provision of emergency response operations, production of the HEOC situation reports. Why do we utilize HEOCs? Many national and international agencies utilize EOCs, from the regional health authorities, ODPM, WHO PAHO, SEDEMA, Ministry of Rural Development and local governments, etc. It allows for proactive planning, efficient and effective communication and coordination, and facilitates structured monitoring and reporting. During the period January to March 2020, before our official establishment of our HEOC for the management of the COVID-19 response, we at the Ministry of Health would have been engaged in the conducting of several tabletop exercises within and outside of the health sector in the management of infectious disease outbreaks, convening of crisis committee meetings and EOCs at the regional health authorities. Modification of the Quarantine Act also took place during this period to include COVID-19. Implementation of travel restrictions, Ministry of Health would have advised on said. Drafting of the COVID-19 response plan, and preparing of initial parallel health facilities, the Cora Hospital and Couva Hospital and Multi-Training Facility. The HEOC utilizes the incident management system, and this system allows us to coordinate and control multiple players and multiple resources at the same time. It identifies an incident manager and 4 main sections, these being operations, finance admin, planning, and logistics. This is a multi-technical group that allows us to advise on the different stages that we're at in our response, identify the resources that we need, and be able to mobilize resources whether internally or externally. This system, this structure, is facilitating all of ministry, all of health approach. This system is scalable and modular in nature and can be expanded or contracted depending on the needs of the response. Our ongoing activities are the establishment of our objectives, strategize our responses, allocate resources, and evaluate our outcomes. And it's a cyclical in nature. Since the establishment of our HEOC in March of 2020, our activities continue to be coordination and procurement of resource demands from PPE, pharmaceuticals, staff and equipment, advocacy and procurement of vaccines, preparing reports for both local, regional, and international partners, oversight of the vaccination efforts, oversight of clinical management of COVID-19 patients, procurement and outfitting of the parallel health facilities, designing and implementation of a dynamic communication strategy, just to highlight a few. Our heightened activities since November of 2021, following the peaks that we've identified from as early as September of this year, our coordination continues to focus on surge capacity activities within the RHAs and all facilities treating with COVID-19 patients. Our continued stakeholder engagement through the Office of Disaster Preparedness and Management, the Trinidad and Tobago Defense Force and other arms of national security, Trinidad and Tobago Red Cross, Ministry of Rural Development and local government. This is a team effort. The Ministry of Health EOC is a combined effort of many patriotic and hard-working individuals from a both technical and administrative and operational standpoint. As the team pushes onward, we urge all citizens to also be part of this collective effort. Follow the 3 W's. Watch your distance, wash your hands, wear your mask, and most importantly, get vaccinated today. Thank you.
And thank you very much, Patty Ann. I now invite the Honourable Minister to provide the latest vaccination figures and an update on the national COVID-19 campaign.
Thank you. Thank you, and good morning, Al. Good morning to Dr. Hines and Patty Ann. Welcome back. You haven't been here for a while. Ladies and gentlemen of the media, and all of you good folks listening or viewing this press conference, thank you for being here once again as we account for our stewardship in this ongoing pandemic. So the current vaccination total up to the close of play last night is as follows. First dose, 639,964, which is about 45.7% of the population. Second dose yesterday, 638,366, about 45.6% of the population. We continue to do roughly about 800 to 900 first doses of a two-dose regime and between 300 to 400 of the J&J. So basically, the pattern of the last couple of weeks, Monday to Friday, doing about 1,200 of these combined first dose of a second dose, and J&J continues to hold. It's not good enough, but it continues to hold. I want to bring the public up to date with some very disturbing developments after I met with all the RHAs yesterday across Trinidad and Tobago. All 5 RHAs, their GMs, nursing, directors of health, Dr. Trotman, everyone, CEOs, everyone. Dr. Trotman has alerted me, and we knew this, and we have been explaining this to the public about children and COVID. Over the past 3 months, we have had 14 children under the age of 1 year coming down with COVID-19. And 11 of those children are under 3 months old. Ladies and gentlemen of the media and the public, I want you to listen to this again. 11 toddlers, babies, under 3 months old are contracting COVID. These toddlers are not going out to work, they are not going here, they are not going there. The virus is basically coming home and meeting them and sending them into the hospital. On examination, 50% of the parents are in fact COVID positive, and we don't have a hard number yet, but the vast majority is what we have been explaining to the country, unvaccinated. And what is happening is that the virus is coming home and being brought into the home setting and infecting the elderly and now very young babies. Ladies and gentlemen, we have had 4 deaths of children, that is persons under 18. But I am hoping that this statistic which I'm given this morning, that is 14 children under 1 year old have been in our parallel healthcare system over the past 3 months. And 11 are babes in arms, still breastfeeding, under 3 months old. So what can we do? And this is where the principle, and hopefully Dr. Hines can go into it, this is the principle of herd immunity. The principle of herd immunity is that everybody in the herd who are vaccinatable should be vaccinated to prevent those who cannot be vaccinated from contracting COVID. It's the same principle for MMR, it's the same principle for polio, it's the same principle for vaccination for infectious diseases. That the herd needs to be vaccinated to protect those few members of the population who cannot be vaccinated from contracting an infectious disease like COVID. So that's the principle of herd immunity. So we need to get all parties involved now that we have explained this to you in some detail. The virus is coming home and meeting these young babes in arms and these young children under 1 year old. So we continue to urge all those who are vaccinatable, that is, all those over 12, to be vaccinated. That is the herd. That 1.1 million people, 12 and over. That is the herd. But that herd now is only 45.6% vaccinated. So we still have a very long way to go to avoid what is happening in other countries, in Europe, other parts of the world. So my simple message this morning is that as we move forward into the Christmas season, a time of celebration, that we need to be even more careful. You are hearing all the warnings from healthcare experts across the world as they move into their holiday period. And what is the extra risk for persons in the northern climates is that cold weather drives people inside. And that is a way to spread the virus. In Trinidad and Tobago, we are lucky to have a climate that allows us to be outside. And we want to continue to urge people in this Christmas season to be extremely careful, especially if you are unvaccinated and you are being invited to a home. Wear your mask. I'm asking persons again, if you are having Christmas functions, try to have them outdoors or open your windows and get as much ventilation as possible so that we could come through this Christmas period that we are approaching and go into January and February, as we did last year. We did pretty well last year, Christmas, Dr. Hines? Yes. We did particularly well last year, Christmas. And we can do it again. So I'm simply urging the population, let's just get vaccinated. Thank you very much, Al.
Thank you very much, Minister. We now go to our question and answer. Media representatives, it's your turn now to direct your questions to the members of the panel as we enter the question and answer segment. We remind our media personnel to state your name and the name of the media house that you represent before asking a maximum of 2 brief questions in the first instance. And of course, if possible, we will field additional questions from media representatives once time permits. Please note that during this segment, we will be taking a few questions submitted by the Media Association of Trinidad and Tobago relating to the national response, COVID-19 response. Our first question comes from The Guardian Media Limited. Good morning. Good morning, Rashad. First question. Okay.
Hi, morning everyone. Rashad Khan, Guardian Media Limited. Okay, so both my questions are to Minister Diyal Singh. Minister Diyal Singh, do we have an update on the status of the morgues within the parallel healthcare system? What's their capacity, and do we have any contingencies as we continue to see deaths increasing or continue throughout this phase? And secondly, I know it was spoken about by Dr. Trotman some time ago, and now in light of this increase in COVID-19 cases, have we reached a point or have we started seeing instances of where some patients who could have been saved may not necessarily been able to get access to that critical resources in the ICU or whatever because of that scarcity? Thank you.
Thank you, Rashad. So on the issue of morgues, we, under the Emergency Operations Center, which Patian said has always been there, since May of this year, we have been meeting with the president of the Funeral Home Association, Mr. Belgrove, to do just that. And Mr. Belgrove is liaising with our Chief Public Health Inspector under the Office of the Chief Medical Officer and my direction to come up with contingency plans. Our morgues at this point in time are not overfull or overflowing. I got some reports which I am crunching now. But the issue is more people are dying. The issue is that we have been advising the country since August of this year that the Delta variant is coming and will lead to more deaths if we don't practice the 3 Ws and get vaccinated. We have been urging, appealing, begging, imploring of people to get vaccinated. So to answer that question, the contingency plans are in place with Mr. Belgrove of the association that deals with funeral homes, and that is firmly in place. On the issue of access to ICUs, Dr. Richards will always report on the ICUs being about 88 to 90%, 95%. They have not reached 100%, and what we did, we reported to the country on Monday that Dr. Richards and myself spent the better part of last week, Wednesday, Thursday, Friday, Saturday, and into Sunday, increasing our ICU capacity because we got 13 more new vents in. And by today, tomorrow, the ICU capacity will be at about 102. We have increased both in Trinidad and Tobago. Tobago will literally double. And in Trinidad, we started off with 2. Then we moved to about 20. Then we moved to 35. Then we moved to 66. Then we moved to 89. By the end of this week, because of the work we did over the weekend, when we got in 13 more vents and associated equipment, we'll be moving to 102. So no patient has been denied access to an ICU at this point in time. Okay, Richard? Thank you for those 2 good questions.
Thank you very much, Minister. We quickly go to AZP News for your 2 questions.
Good morning, everyone. Priya Bihari, azpnews.com. Minister, I just wanted to take up from the ICU issue. AZP News has been told that there is 1 nurse for every 4 patients in ICU when there should be 1-to-1. And that nurses are being taken from the ward level, given a 5-week crash course, and put into the ICU wards when that training normally takes 2 years. So my question is, therefore, is this an issue, and is this leading to an increase in deaths in the ICU? Thank you.
So the answer is no, and I'll explain why. As I explained to the country prior, in normal circumstances, yes, you would like 1-to-1. We are not in normal times. We are in a pandemic, an emergency. And I did explain, to make up for the human deficit, since last year, we actioned at Couva especially, and doing it now at St. James and the other hospitals, electronic monitoring of patients, which is actually better, and I'll tell you why. The screens that are set up in the cold zone have alarms and bells and whistles, which automatically tracks the patient's SpO2 levels, pulse rate, cardiac rhythms, and one other parameter which I forget now. And whenever something amiss happens, the alarm goes off in that electronic monitoring system. That way, important resources can be sent to that patient. And that is one way in a pandemic, when things are not ideal, you still maintain an optimal level of care. And we did that proactively because Couva was not built with a central monitoring electronic system. We inserted that. And we are doing that right now at St. James, and we are going to do it at the other systems. We have trained since last year about 200 nurses in ICU management. We brought in about, I give the figures, 18 and 7, about 25 ICU nurses from Cuba. And the fresher ICU nurses who have been trained and are doing their practicals, they are always paired with a more experienced person. So no patient is under the control of an inexperienced team. There's a mix of experience and fresh talent all the time. Thank you, Priya.
Thank you very much, Minister. We quickly go to TTT for your 2 questions. Good morning.
Good morning, everyone. Kimberly D'Souza from TTT News. I have two quick questions for Minister Dialsing. Minister, can you tell us how many healthcare workers have passed from COVID since they've been battling the virus? And also, Minister, the last update we got on this, but not really students, but the last update we got in terms of the education system, I think we got that 55 people contracted COVID. Can you tell us how many students have contracted COVID since school reopened thus far? Thanks.
Thank you. Just repeat the first question, please.
My first question,
number
Minister,
of healthcare workers. Sorry.
Yes.
I recall there was one doctor in Tobago. There was recently a doctor in the Mayaro, Rio Claro area. I don't have the exact figure, but I don't want to mislead you by quoting a figure. But my information is not significant. What we do with healthcare workers, especially working in the healthcare system, because we have no control of them in their community. But once you are working with us, we make sure you have the highest world-class level of PPE, and you are encouraged to get vaccinated. That is what we are doing, and I am doing as Minister of Health. We have never, ever run out of PPE in Trinidad and Tobago. Never, ever, ever. So we continue to provide them with the best level of PPE, and we encourage them to get vaccinated. If they contract the virus outside in their community settings or home setting, that is regrettable, but that is it. Right. So I have an update about students. Now this update from the ministry, from my colleague, the Minister of Education, is week 15 to 19th. I spoke to her this morning. She will send me an updated report. So I'm giving you this report from the Ministry of Education from the 15th to 19th. Total quarantine 84, staff 43, students 41. Breakdown by district: Port of Spain, 2 positive, 7 pending. Northeastern, 0 positive, 0 negative, 7 pending. Caroni, 8 positive, 5 negative, 3 pending. St. Patrick, 2 positive, 0 negative, 3 pending. Victoria, 6 positive, no negative, 2 pending. Southeastern, 1 positive, 1 negative, 7 pending. St. George East, 2 positive, 0 negative, 5 pending. The information goes on to state, no student out of physical school, to the knowledge of the Ministry of Education, has been hospitalized. But as I said, this is up to November the 19th. I'm expecting an up-to-date report this morning. During the week 7th to 13th November, well, this is old data. Positive results 23, negative results 13, pending results 35. So that's the most up-to-date information I have from the Ministry of Education. As I get more, we will share it with you folks in the media.
Thank you. As we move on, we go to Newsday for your 2 questions.
Hi, good morning. This is Paula Lindo from the Newsday. My first question for Dr. Hines is, with more people circulating or beginning to circulate as people begin to shop for Christmas gifts, is the ministry worried about the effect this could have on the numbers? And what advice do you have for people who, will be doing this? That's my question for now. Oh, sorry. My second question is, we've seen staff in the traditional healthcare system also complaining of burnout and stress. What measures is the ministry putting in place for all healthcare workers during this time? Thank you.
Thank you, Paula, for the question. I will take question number 2, and then we'll go to Dr. Hines for question number 1, because question number 2 is really the responsibility of the Minister of Health and the Ministry of Health. So as we've been seeing, healthcare workers have been under the gun since March of 2020. We employed several strategies. One, psychological support. And you had a testimony from Nurse Josette here, who extolled the virtues of the quality of psychological support. However, mental scars don't heal like a physical scar. We employed strategies like transportation, meals, time off, and other strategies to ease the strain. But as this virus bites more and more, and the unvaccinated demand more and more health care, we have always been concerned about the physical and mental well-being of our healthcare workers. I met with them again yesterday, and these are people who find stores of energy and inspiration within themselves on a daily basis to come out and do the job and do the work. And it's so inspiring to lead that team. But the Ministry of Health and the RHAs have been doing a fabulous job in supporting them. However, the missing ingredient is the concern for healthcare workers by members of the public, who, the largely unvaccinated, are making more and more demands on these heroes of Trinidad and Tobago. And it's not only Trinidad and Tobago, Paula, and I really want to thank you for raising the issue. It's a regional and global issue. And the way we can work together with the population is for the population to make a decision. Even if you don't want to be vaccinated, and that is your right, you need to adhere even more rigidly to the 3 Ws. Washing your hands, wearing this thing called a mask, and social distancing. That way we can drive cases down. And we have the history and the precedent in Trinidad and Tobago in March, early March, as Dr. Hines will tell you. In early March, without vaccines, our rolling 7-day average was 3. And I remember coming to these press conferences in March, April, May, and every 2 days, 3 days saying, we are moving from 3 to 6, from 6 to 18, from 18 to the 30s, from the 30s to the 40s. But we were doing that then without vaccines, by adhering to the public health measures. And Paula, your concern for healthcare workers is my concern, but the population needs to work with us now. Even if you are vaccinated, you still need to wash your hands. You may not end up in a hospital because there's a promise of vaccinations. And what we are seeing is that promise is being kept, where 92% of the persons presenting to the parallel healthcare system are the unvaccinated. 97% who die are the unvaccinated. So if you do not wish to be vaccinated, that's your choice. You have to help us by being cleaner and distancing even more, especially at this time for Christmas, and you mentioned shopping. Thank you very much.
And thank you, Minister.
You have to go to Dr. Hines.
Okay, and thank you, Mr. Lindo. For the first question, it's an opportunity to remind the population of what we have been saying, and that is that as we do note that there are increasing volumes of individuals in circulation, we do have a concern, and we've expressed that concern, that increasing movement can lead to increased transmission, and we have outlined the steps that the population can take to reduce that risk. Those steps include, as the Minister pointed out, adherence to all the public health guidelines. Those steps include using discretion and common sense in how you occupy spaces. If there's a place that's crowded, then it's probably not the best idea to add to the crowd by inserting yourself into a crowded location. It is advisable, if we're moving around to conduct our business, that we don't linger in any one place. We get our stuff done and keep it moving. It is advisable, as we've been saying, to make sure that as many individuals as can get vaccinated do so, so that they reduce their risk of getting the virus, reduce their risk of spreading the virus if they do get it, and reduce their risk of ending up in hospital or having a fatal outcome, even if they do get infected. These are the steps that can be taken. The increase in movement is inevitable as the economy opens up and as we attempt to balance the lives and livelihoods conversation that you've heard the Prime Minister and the Minister allude to repeatedly. So all we can do is provide the information and the means to reduce risk by having the vaccines available and giving the information on how to reduce transmission even as we go about our daily business. So I hope that adds some clarity.
Thank you, Dr. Hines and Minister. We go to CL Communications.
Good morning, Vindar Suraj from Caribbean Lifestyle Communications. Just one question for the Minister. In Tobago, Mrs. Davidson Celestine had confirmed that the rise in cases there were due to the Delta variant. So we're just wondering if it's possible to get a similar confirmation from the ministry that the recent rise in cases in Trinidad is attributed to the Delta variant at this time. Thank you.
Okay, thank you for the question. I do believe that we have already outlined that. We've said that as that particular variant, which is more transmissible, gets into a population, what it tends to do is to displace other circulating variants and become the dominant variant. And because it is a more transmissible variant, it tends to lead to increases in transmission, increases in numbers. And that's what we're seeing. So that's what we have been describing. We have already described the fact that we've established what they call community transmission of this Delta variant. And as other countries in the world have seen, when they actually establish community transmission of the Delta variant, they have seen cases go up. And really the only remedy for that is to have the population protect itself via the public health measures and via the available vaccination.
Thank you very much, Dr. Hines. We go across to Matt now, and we'll field a few questions from Matt. The first one, are persons diagnosed with drug use disorders considered to have a comorbidity and therefore at higher risk for contracting COVID-19? If not, why not?
Okay, that's an interesting question. Now, drug use disorders themselves won't count as a comorbidity, but those drug use disorders can lead to various things, including choices, behavioral patterns that put individuals at increased risk, and some of them actually also cause various kinds of organ damage, which can generate the more established or well-known comorbidities. So while drug use itself isn't a comorbidity, the decision-making process that can be impaired by psychoactive drugs is an increased risk in and of itself. So we do want to encourage all individuals to adhere to the public health guidelines, avoid the use of psychoactive substances, and to make the best possible choices as they go about their daily business.
Thank you. A second question. Are doctors in the parallel healthcare system also working in the traditional healthcare system and therefore possibly transmitting the virus to their patients?
Thank you. So, by and large, the majority of persons in the parallel healthcare system work there exclusively. However, there will be some interaction between specialists and some nurses going from system to system, especially if you have a case in the parallel healthcare system that needs specialist care like orthopedics or some other condition. However, as I said earlier, all our healthcare workers, to avoid that cross-contamination that the question is alluding to, and it's a good question to ask, because 98% of our doctors, and the question asks about doctors, are vaccinated and have the highest level of PPE, the chance for that cross-contamination is almost virtually eliminated because our doctors are about 95 to 98% vaccinated, and they always have the highest level of PPE. Thank you very much.
All right, we'll just do one more question.
Sure. Okay.
And this one is for the panel, and it comes from a frequent traveler. He asked, the testing swab up your nose, close to the brain, has been adjusted to swab the nostrils in the US. Does TNT plan to do the same? And if so, when?
Okay, I think I'll take that one. The swab that they're referring to is the nasopharyngeal swab, and it does sometimes feel as though it gets to the back of your eye. It does not get to your brain. And that is the recommended sample for the tests that we perform, both the PCR and others, the gene expert, etc. So that's not going to be adjusted at this point in time because the recommended sample is a nasopharyngeal sample, which is where we tend to find the majority of the cells that would be infected with the virus and therefore have the viral RNA that we're looking for.
Thank you, Dr. Hines, and we come back to our reporters. We go to Guardian Media Limited for a follow-up question.
Morning again, everyone. Well, this question that I have is for both the Minister and Dr. Hines. So, Minister, you were speaking a bit there about herd immunity, but given the current national vaccination policy, and those who qualify to get the vaccine, we would only see ourselves or our country vaccinating about 78.1-ish% of our population if everyone who is eligible takes a vaccine. But we're seeing internationally that experts are forecasting that for herd immunity, we need about 80 or 90% of the population to be fully vaccinated. So does the Ministry of Health perceive this as a gap? And if so, how do we intend to address that gap? Do we have to wait until vaccines are expanded into other categories of people so that we can maybe get our numbers up in those demographics?
Thank you, Rashad. Nice question. So the only demographic that is excluded from being vaccinated is anyone 11 years and younger. Why? Because at this point in time, WHO has not approved any vaccine for that demographic. There are, as far as I know, 2 vaccines before WHO seeking EUL, Emergency Use License, or EUA, Emergency Use Authorization. That is Pfizer and Sinopharm. Once those are authorized and get EUL or EUA, Trinidad and Tobago will, as we have been doing, and we have been, as we said, we have been engaging both Pfizer and Sinopharm for these vaccines once they become available. So, in the interim, we have a vaccinatable population of 1.1 million. 1 million over the age of 18 and 100,000 between 12 and 18. We need to get much more of that population vaccinated. And that, again, is the principle of herd immunity, to protect those who cannot be vaccinated at this point in time. So, all of us have a duty of care to our neighbors, our families, to get vaccinated, to protect them. As I always say, Richard, the example that I use is that, yes, all of us have free choice, but I don't have the choice to drive down south on the northbound lane of the Uriah Butler Highway and kill people. I simply don't have that choice, because I have a duty of care to my fellow citizens that they should not die by my hand. So the problem globally, and this is a global issue, and I really welcome the opportunity to once again say this. All of us at this point in time have this duty as part of a society. A society, yes, is made up of individuals, but these individuals have relationships with others, and we have a duty of care to others. And that duty of care now extends to how do we deal with the virus. So if you don't want to be vaccinated, as I said, I may not agree with the position, but I respect it. But you now have a duty to be even more careful with hand washing, masking and keeping away from people. That is your duty now. If you don't want to be vaccinated, then you have that duty. You have that right not to be vaccinated, but you also have a duty to keep away from people so that you don't infect them and indirectly cause the death of someone else. So thank you for Richard for again raising that. You really raise a moral and ethical issue. Thank you very much, my friend.
Thank you, Minister. And I want to remind our media representatives that we do have Ms. Patty Ann Williams, our Chief Technical Coordinator in Disaster Preparedness, here with us. And feel free to pose questions relating to the Health EOC at your convenience. We now take a further question from AZP News.
Good morning again, Prior Bihari, AZP News. There is an issue and a concern by healthcare workers at the St. Anne Hospital. They are citing that at least 4 of the healthcare workers passed away recently due to COVID-19. And I don't know, they are saying that the place is in a mess and they want some assistance. I don't know if the minister could lend some assistance. And there's also reports of shortage of scrubs at the hot zones throughout the country. I don't know if you can shed any light on that for me. Thank you very much.
So thank you, Prior. So I don't know what is meant by the hospital in a mess, but my information is that in a pandemic, we are doing the best that we can. I have no report, and I was with the CEO of Northwest Regional Health Authority this morning when we launched the COVID vaccination drive at a major retail outlet this morning. And we spoke about the hospitals under her purview, and she is not of the opinion that you have shared. On the issue of consumables like scrubs and so on Monday, I asked the principal pharmacist, Mr. Nisa Sibu, if we have shortages of anything like PPE. And she has reported to me there is no shortage of PPE at this time. So I hope that corrects the impression that you may have had. And Prior, I'm going to ask you a question now. And you know what the question is, yes or no? Have you got your flu vaccine as yet? Prior, oh God, we go fall out. Go for your flu vaccine, now, brother.
But I believe we may have to bring that flu vaccine to him.
I'm going to have to go and drag him to our center, you know.
Yeah, probably.
I try to keep him as much as possible, Minister.
Okay, good.
I do really good.
Radio Tamarin, we are ready for your questions.
Yes, good morning. Clayton Clark, Radio Tamarin. Mr. Minister, you announced earlier this week that the country is currently experiencing a third wave of the COVID-19 virus. How does this wave compare to the first 2 waves? Is it too early to make that comparison? And if you can, in terms of deaths, number of infections, how the health facility and frontline workers are coping with this current wave?
So I have addressed the issue of the frontline workers several times today. There's nothing more I could add about frontline workers. We cherish them. We protect them with PPE, the highest grade of PPE. We encourage them to be vaccinated. We have started to give them as much leave as possible so they could relax, they could decompress. We have provided them with psychological counseling. In many instances, we provide them with transport, as I said this morning at every single press conference. So we cherish them, but as I always said this morning, we need the public now to cherish them equally. And I will turn you over to Dr. Hines about the other question.
Okay, now I think that what you're looking at or questioning is how the situation we're in now compares to previous surges. And the most important factor that we need to consider here is that the variant that we now acknowledge as the likely dominant variant is one that has the potential to transmit itself more quickly than the previous ones that have circulated. So against that backdrop, knowing that there's still a significant proportion of the population that is not yet vaccinated, there is the potential for another surge of equal or greater proportions than the ones that we've seen so far. And we do want to ensure that everyone is aware that this remains a threat and that this threat can only be mitigated by increasing our vaccination levels and by increasing our adherence to those public health measures.
Thank you very much, Dr. Hines, and we'll take our final question from Guardian Media Limited.
All right, thank you again. Minister, I think we may have veered off in that last question a bit from what I was asking. I think I may have put it in a bad way, but essentially, are we comfortable with that 78.1-ish% of the population that are eligible for vaccines? If by tomorrow, by some miracle, we get all those who are eligible to take the vaccine, is that, well, will that put us in a comfortable position in light of that belief that we may need about 80-90% of the population for herd immunity?
Okay, let me see if I can add some clarity to that. So we keep using the term herd immunity, and I think that there is a concept that this herd immunity is an all or nothing state, which it is not. Now, when we speak about the level of vaccination required to reach herd immunity, we're speaking about the level of vaccination required to essentially extinguish transmission, meaning the virus does not have the probability of finding a susceptible person to jump to, even if it enters the population. And that level of vaccination varies depending on how quickly the virus itself can transmit itself from one individual to another, that reproduction number, whether it's the basic or the effective reproduction number. Now, because herd immunity, or because levels of immunity in the population aren't all or nothing, the further we get in vaccinating the population, the slower the virus will be able to transmit itself. So if we can only vaccinate a given percentage of the population with the available products, and we get all the way to there, although that may not get to the point where we extinguish transmission completely, it will most certainly slow the number of new cases that we get. I'll give you an example of what herd immunity actually looks like. When last have you seen a measles case in Trinidad? That's herd immunity. That's us looking at enough of the population being vaccinated that even if someone comes in with measles, it doesn't generate a chain of transmission. But even in the absence of that level of immunity, the higher we get with immunizing the population, the higher the level of, or percentage of immunized individuals is in the population, the slower the transmission will be, the smaller the numbers will be. And that in itself will then help to protect the health system, help to protect the population that needs to access healthcare, etc. So we're going to continue to push to get as far as we can with the products that we have.
Thank you very much, Dr. Hines. And we turn you over to the Honourable Minister for his closing statements.
Thank you very much, Al, and thank you for the panel this morning. Thank you, ladies and gentlemen of the media, for once again coming out. At this point in time, with the last few seconds that I have, I want to make a direct appeal to Trinidad and Tobago, whether you are vaccinated or not. As we move into this period of Christmas, which is associated with gatherings, and is a joyful time, I want to urge the population that the public health measures of washing your hands, social distancing, and wearing masks, whether you are vaccinated or not, is still of paramount importance. For your home gatherings, try and keep them as small as possible. Even if you are inviting unvaccinated folks, your families, friends who are unvaccinated, try and space out in open air spaces, like your garage, like your porch. If you have to go inside, open your windows. Don't use air-conditioned spaces. If you have to gather for lunch or Christmas dinner or whatever, try to space out, not one next to each other. Try to have your little gatherings in a socially responsible way as far as humanly possible. We did it last year. We did it last year, Christmas, and we came out of it pretty good. This year, with 45% of the population being vaccinated, We should do even better. However, we do have the Delta strain to contend with, which is infinitely more transmissible. How much times, Dr. Hines? Is it 14 I'm hearing? It depends. It depends. But the fact is, it is much more transmissible. And speaking on behalf of healthcare workers, we need a break. And the only way they can get a break is if we get our rates of infection down. So, in order to save some more lives, I'm asking that we adhere to the healthcare measures in order to protect the physical and mental health of our healthcare workers. We need to get these numbers down. And the only way to do that this Christmas, just pass the sanitizer for me, please, is keep on sanitizing your hands as much as possible, whether by washing or sanitizing. This thing, this mask, is going to be so crucial this Christmas as we gather. This is going to be defense mechanism probably number one. And please, when you invite people into your homes, be careful, social distance, do it in open air spaces. And if we do those things, you know, we could come out of this Christmas 2021 in a better place than we go into it. So ladies and gentlemen of the media, thank you once again most sincerely for coming out to these press conferences and carrying the message. Thank you very much.
Thank you for joining us, and goodbye for now.